All right, so we move to the next stage, and we want to talk some psychology at the moment. Dr. Jason Scott Hamilton, sports medicine. Is it psychology?
Yes, psychology.
Sports medicine psychologist.
Yes.
All right, so I want to get that term right. Back in Jamaica, understand that you're abroad for a little bit. We'll ask you about that. But we understand that you're back and will be helping some schools for their preparation for champs.
Yes, sir.
All right, so before we get to that aspect, tell us, where were you? Because I know you're in demand all over the place. And what has been your latest project?
Well, glad to be back on the show, Orville. I was just recently the IOC diplomat for the treatment of mental health in elite athletes. So that was a 2-year program that I completed and graduated in Geneva the 28th of October last year. So first Jamaican to do that, and as a result, I'm always here working with the Jamaica Association of Sports Medicine to help our athletes, and whenever I can get called up, I'm willing to help.
All right, so you say it's a 2-year program.
Yeah.
Mental health in elite athletes.
Yep, treatment of mental health.
What are usually the kinds of things that elite athletes suffer from mentally?
There's a host of them. Athletes suffer from the same things that your normal patients will suffer from. There's anxiety, panic attacks, nervousness. But when you're competing, and what a sports psychologist tries to do is, you're going to deal with clinical issues, that's one thing, but it's to help an athlete get to perform on the day they need to perform, the way they need, at their best.
We have a clip that we want to play, and then we'll ask Dr. Hamilton, what's his take on it? Watch this, and we'll come back and we'll talk about it right now.
Yo, here with my man, Dr. Hamilton. He's a wealth of knowledge. Alonzo Mourning, good prep brother, friend of mine. He's doing his thing. He really is. Listen to him. He's got some wisdom to share with you.
Appreciate you, Joe.
All right.
Shoot. The limbic cortical region, or the region that I say causes you to do dumb stuff, loves drugs, loves weed.
Hi, I'm Shaquille O'Neal, the most dominant sports figure ever, and this is Dr. Hamilton.
Most of the athletes that I work with, I say, I'm going to introduce you to yourself in the future.
Oh, brilliant.
Dr. Jason Scott Hamilton.
I am the licensed clinical sports psychologist.
He's developed a reputation as a trusted expert in the field, helping top athletes to achieve peak performance.
His insights don't just apply to sports. They can transform the way you think, perform, and succeed in any area of life.
I was working at the school that Jeff Bezos went to here in Miami. I used to give students a business card, and I'd say, give me the card back when you're a doctor. 2017, I got my 151st card.
What is it that separates the highest level people versus everybody else?
The ones that really make it are... There is Shaq in like a police car, but there's no driver's seat. Shaq was playing, and we took pictures with Shaq after and everything. So we come out of the arena. You know, like when the police pull you over? I heard Dr. Hamilton and Jason Hamilton, please step out of the car. Oh, this officer, no, I'm Dr. Hamilton. And he goes, arr, 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 arr. Oh. When I step out the car, there is Shaq in like police car, but there's no driver's seat. He's driving from the back seat.
Where's that car now?
I don't know. Shaq is an amazing guy.
Yo, this the OG from the Miami Heat, Udonis Haslem, man, with Dr. Hamilton, man. Sports psychologist, man. Taking care of your mental health, man. Health is wealth, man. You know what time it is.
Yo, here with my man, Dr. Hamilton. He's a wealth of knowledge. Alonzo Mourning, good prep brother, friend of mine. He's doing his thing. He really is. Listen to him. He's got some wisdom.
Boy, Doc, you're rubbing shoulders with some very powerful people here, man. Alonzo Mourning, Shaq. Interesting, eh?
Yeah.
Before we talk about your work at Champs with some students, let me ask you this. Are there sports-specific principles that you pass on? Let's say a basketballer comes to you with the biggest fear athletes have, fear of performance.
Right.
A fear of not doing well, nerves, anxiety, whatever you call it.
Yeah.
But cricketers will have it, footballers will have it, swimmers, netballers will have it. Are there specific things that you do based on specific sports people, or there's one size fits all.
No, it's definitely not one size fits all. So as a clinical psychologist, what separates us is that we can do an evaluation, a neuropsychological evaluation. So I would get to know Oliver really well by your scores on the evaluation, so I understand how your brain works. And for example, confidence is the ability to shut off your conscious mind and allow your unconscious mind to do what it knows, or your subconscious, right? For example, if I said to you, Orville, I'm going to give you $250 million, right?
I would say you're lying.
No, but yeah. So we get it. So we get the sponsor, $250 million to tie your shoelaces in the national arena, right? You're going to get one opportunity to do it. Right now, you know to tie your shoelaces very easily. It's your subconscious. You don't even think about it. You've done it so many times, like riding a bicycle. Right. But now that I said 1 week from now, the entire Jamaica and everybody in the world going to watch you. You get one chance, you know. Yeah. If you make a mistake, you don't get the 250 million.
I will be able to tie my shoelaces.
What you know?
I guarantee you.
What you know? But the fact that I put it, I'll give you a week and you're practicing it every day. Yeah. You've brought it into the conscious. You're now thinking. Many times people make mistakes by overthinking at the performance time.
I get that. Before we want to come back to, come to you helping some athletes at Champs. So I have to ask you this. Some of those names that I see you talking to, the Sharks, the Alonzo Mornings and so on, I understand that you may be able to carry them to Jamaica to help?
That's one of the things that we're trying to do is people like to come to Jamaica and to do sports retreats. And like that thing where they said I had 151 doctoral student. For years, I used to be a dean in the College of Medicine at FIU, and I was the director of research. So to bring those young doctors and to bring athletes here, you know, and to speak on peak performance and present on that is something that we are definitely looking at. Yeah.
All right, to understand, you'll be doing some work at Champs with some athletes and some schools. What can you tell us?
Well, one of the things that I'm really happy for, because I've been doing this for years, and usually they're only concerned with the physical maladies or the physical things that happen to an athlete. But you're an athlete and you run the 110-meter hurdle and you lead in the race, and at the last hurdle you hit it, bust up your face, and you don't make it, right? You lost the race. Some people not concerned with that athlete anymore, you know. That athlete really need help. And there's been examples where I'm helping them athletes for a long time. Right? But I'm proud that the Jamaica Association of Sports Medicine and Champs have seen it now. When we're filling out the medical forms, there's parts there where it's for the psychologist. There's parts there where the athlete wants to talk to somebody. I just finished talking to a youth a while ago. Can't really call what school, but it's 3 years in a row. And I'm injured just before Champs.
Wow.
And he's a phenomenal athlete.
Who decides who you see?
The coaches, what is happening now, Orville, is that, and I'm glad, coaches are asking for me, athletes are asking for me, you know. I went to JC, I went to Titchfield.
So the schools call you?
Oh, yeah.
So you make yourself available. Hi, I'm Dr. James Hamilton. I'm a sports psychologist. And you make yourself available. So the teams, the schools call you based on how they see fit. So it's not you imposing yourself.
No. I'm there in the sports medical department. I'm over in the Stadium East.
Right.
And I'm getting called on the walkie-talkie. I'm called all over the place.
All right. We're coming up to our time signal. We'll have to take that. And then we understand that we may take one quick little feature and then we wrap up our talk with the doc. We're coming back after the break. Welcome back. We're wrapping up our talk with Dr. James Hamilton, telling us about the work. Jason Scott. Telling us a little bit about the work he's doing with I don't know where that name came from. All right, so you're saying you're doing some work with the youngsters at Champs, and you've seen at least one case. A youth gets injured 3 years straight just before Champs. Could that be mental or just salt himself?
No, some of it is physical. It is definitely, because I'm in there, and Dr. Safia Franklin, Jamaica Association of Sports Medicine, the muscle is pulled.
Yeah.
You understand? But mentally, that wearing on you. He got, and I don't want to give it away because you'll figure out who it is, but he you know,
Yeah.
it's not easy. And yeah, there's crying. You remember that commercial where they used to say ABC, Wild World of Sports?
Yeah.
The agony of defeat.
Yeah,
Well,
the
there's
thrill
a
of
lot,
victory
and the agony of well, there's a lot of agony of defeat.
I can imagine. There's one more clip that we need to take, and then we wrap up with the doctor. Take a look.
All right.
Alonzo Mourning, good prep brother, friend of mine. He's doing his thing. He really is. Listen to him. He's got some wisdom to share with you.
Appreciate you, Joe.
All right, shoot.
Hi, I'm Shaquille O'Neal, the most dominant sports figure ever, and this is Dr. Hamilton, the most dominant sports psychologist ever. Listen to him. He knows what he's talking about. He helped me get 4 of them things.
All right, I'm almost sure we saw that earlier, or was there another part?
Yeah.
That was
Well,
it.
the part that they showed it already. The part that they wanted was I was with Greg Lee for the Reggae Boys, and we do a thing called EMDR, which is just visualization, and he saw himself score the goal that he scored that day in 1 minute into
All
the
right,
game
I'm
against
going to ask you
USA.
about that because I know you're doing some work with the Reggae Boys as well. We have maybe a minute before we have to run. Tell us about what you're doing as far as the Reggae Boys are concerned.
Well, I was a part of the sports medical team when we went to Copa and the Nations League.
Right.
And one of the things so the IOC, I think called Sports Mental Health Assessment Tool, and I would do visualization with the athletes. So Greg Lee and Dexter Lebenkisa, they did the EMDR, which is just relax and see yourself, right? Scoring the ideal goal, making the ideal pass, making the ideal tackle, but you're just doing it over and over. So you're telling that part of the brain, which does performance, what you'd like to happen. So when the game started, and when I interviewed him, he said, well, I saw myself score that goal this morning in Dr. Hamilton's office.
Yes.
You know? Yeah,
said
so
that.
that was really cool, yeah.
Right.
Yeah, it was on ESPN, yeah.
All right, so we maybe one more. What's the most common complaint that you get from athletes? Or what's the most common thing that you have to work on as a sports psychologist?
Fear of failure.
Fear
right?
of failure.
And they've practiced. You understand? There's many athletes that perform better in practice than they do on the day they need to do well,
Yeah,
right?
yeah.
So when they get there right now, it's hard, you know? We have some athletes that are really very good at it, you know. Once they get there, until you see them smiling, done.
Done. One more for you. We always think athletes need sports psychologists when they are not doing great. Is there a case for the necessity of a sports psychologist when you are doing great? Somebody up on a roll.
Yeah, everything going good, but all the sports psychology. Listen, most athletes' career finish by about 35.
All right.
Right? And if one of the things they say in that video is that I introducing you to yourself in the future. You're going to have 2 great swimmers come up here right now. Alan Roy Marsh was in my class. Any great athlete will say, if I knew then what I know now, I'd have been a better athlete. So when you're doing well, all I do is helping you understand. Just manage your mind, man.
Manage your mind.
Manage the limbic cortical region.
All right, Dr. Jason Scott Hamilton. I got that right.
I appreciate it. Yeah, man, you get it right, man. Bless him.